Hi, Paul Gomez here with Unified Languages. We are a language services agency providing services in over 150 languages, focusing in the workers' comp, medical, and legal arenas. I hope you have a wonderful day today and thanks for watching this video. Why do we need consecutive and simultaneous interpretation in medical appointments? Well, most interpretation services that occur within a medical appointment only occur in the consecutive form. But there are very specific times where simultaneous is used as well. And this mainly occurs in the workers' compensation field, where you're going to have a case manager, the doctor, the interpreter, and then you're going to have the patient. Well, obviously, as you know, if you're a case manager or an adjuster or such, the patient goes in first with the interpreter so that they can have a private meeting, and then the case manager comes in. Well, a lot of times what happens is, you only provide consecutive interpretation for the doctor and the patient in the first part of it, which is absolutely acceptable. But then when you come in as a case manager, a lot of times you have a mini conference with the doctor as to what went on prior to you coming in. That is the place where simultaneous must absolutely take place. And most interpreters and most services do not do this. They only give a synopsis of what's being said to the patient, and the patient has the absolute right by law to be present at all times. If he's not hearing exactly what's being said between the doctor and the case manager, he's not being present and he's being denied a constitutional right. Therefore, the interpreter must be qualified to provide interpretation services in a simultaneous form. Right at that second is very, very important. Summarizations or synopsis of what's being said are not acceptable. At least, and they're not. And this is not punishable by law or anything, but this is the absolute right of the injured worker or patient to be present at all times and to know what's being said. Otherwise, he's being disserviced. So this is why the interpreter must have knowledge of simultaneous and consecutive interpretation. Consecutive is used mostly in these types of settings, but during medical appointments, I would highly recommend hiring somebody who is certified and who has passed all the testing so that you can get all the information. A lot of times the patient has questions in between, and they'll be able to interject and be present and have a conversation, or maybe they didn't quite understand something beforehand, but because it was repeated, then he now thinks about that and asks a question and something is clarified. So there is a multitude of things that can arise from this, that can benefit or disservice the patient. So that's why consecutive and simultaneous must be used by a proper trained interpreter, and we can provide you with that. Thank you so much. You can call us at any time if you have any questions at 704-659-1869. You can call 24/7, or you can email me directly at paulgomez@unified-languages.com. I hope you have a wonderful day, and we look forward to hearing from you. Thank you.